Hello everyone. So this video is going to be regarding hydatid disease, that is a parasite-borne infection. It is caused by a parasite that is Echinococcus granulosus, also known by name of dog tapeworm, which have a definitive host as dog, and intermediate host which are mainly sheep and cattle. Incidentally, human are the intermediate host, which are increasing now. So dogs receive the ingestion of cyst via intake of the organs or tissues from the intermediate host, that is sheep and cattle. These cysts within the dog mature into a mature tapeworm which are going to lay eggs, and these eggs come in the feces of dogs and are laid in the soil. These eggs are highly resistant to the extremes of temperature, either via close contact with dog or ingestion of the food, and close contact with the fomite which are infected by these eggs can lead to intake of these eggs within the human oral route and reaching their GIT. And this is where the story begins, and these eggs enter into the human body and mature into cyst, and these cysts are what are going to cause infection and hydatid disease in humans. Let's try to understand structure of this cyst first. So these cysts can be found in virtually any organ of the human body, because hydatid disease can infect protein in its manifestation. So these cysts have three layers. Okay, let's try to understand it. So the first layer, outermost, is the pericyst, which is actually formed by the compression of the surrounding tissues or organs. So it is host origin, pericyst. The next layer is intermediate ectocyst, which is hyaline in nature and non-infectious. The second layer. The innermost layer is the endocyst, also known by name of germinal membrane, because it contains the viable parasite within it, and hanging from it are these daughter cysts. When the hydatid cyst rupture, daughter cysts are released within. So the infectious layer is the endocyst or the germinal membrane. So we studied about the cyst. Now let's try to understand uh, this in another magnified image. So this is a magnified image showing the three layers, that is the fibrous layer, ectocyst. Okay, outside of it is the host origin pericyst, which is also shown by name of fibrous layer. These are derived from the host tissue, and the innermost layer is the germinal layer, that is endocyst, hanging from which we can see daughter cyst with scolex within. Group 1, Group 2, and Group 3. These are three groups that were classified by WHO for hydatid disease. So Group 1 is an active group with cyst more than 2 cm in size and is fertile. This active group is going to transform into transition group, where the cyst either degenerate or goes into a transitional stage, and this degeneration or transitional stage of cyst reaches because of host resistance or treatment that the host has received. This group 2 may or may not contain viable proctoscolex. Group 3 is an inactive group with degenerated, partially, totally, or calcified cyst. The least possibility of having viable proctoscolex is in group 3. So these were about the hydatid disease transmission, the cyst, the classification. Let's go into clinical feature of the disease. We studied it as protein in presentation because it can colonize any organ. If suspected in a healthy farmer, the healthy farmer will come with a complaint of gradually enlarging mass in the right upper quadrant. We suspect a hydatid liver. The patients may be asymptomatic. There can be incidental finding on searching for pressure effect. So hydatid cyst can itself not present with some symptoms, but it can, enlarging size of hydatid cyst can cause pressure effect in the surrounding. And while searching for the cause of this pressure effect in CT scan, we can find the cause to be hydatid cyst. The symptomatic disease in a hepatic lesion will lead to dull pain in the right upper quadrant, or the generalized abdominal pain because of the stretch of the liver capsule, vomiting, and other abdominal symptoms. A pulmonary lesion, if large enough, can cause dyspnea. Daughter cyst within the hepatobiliary tree can cause obstructive jaundice. Let's see this image. So this image shows a large hepatic cyst which has many daughter cysts, and these daughter cysts have obstructed the biliary tree, and finally there is the obstruction within the biliary tree, and we can see the dilated biliary hepatobiliary tree. This is the CBD. It has completely dilated, and this will finally lead to obstructive jaundice in the patient. Another presentation can be raised ICP symptoms and headache if the hydatid cyst have involved the brain. Another classical presentation can be pain abdomen after a minor trauma. So let's see this image first. So this is an image with this is a CT scan actually, which shows the cross section of the liver, and in liver we see this lesion which is around, which has irregular shape but has two ends. Okay, mainly two ends, and we can see a lamellar membrane or two margins we can see. So here is a margin of the hydrated cyst which is actually separated from the pericyst after the trauma. And this separation of the pericyst from the ectocyst causes a abdominal pain and may present with some symptoms of hypersensitivity too. Okay. Another presentation can be anaphylactic shock due to rupture. So if a hydrated cyst ruptures, the scolex or the proctoscolex reaches through tracheobronchial tree and stay there. When the patient coughs or has a bout or has an anaphylactic shock, in the cough the patient will have white material which is rich in the proctoscolex. So these were few presentations of disease, hydrated disease. About the management, we will discuss in another video. Hope you liked it. Thanks for watching.